My name is Mary McDonald. It's actually not necessarily what brought me to Greece and to this wonderful hospital. It's more about finding the right doctor, and that doctor happened to be here, and I lucked out that it was in Greece, and it was at probably one of the best hospitals in the world. My condition is a congenital defect, myocardial bridge. I've been suffering from this condition for probably longer years than 4, but 4 significantly. I'm 61 years old and suffered so severely. And as an athlete, I'm a marathon runner, I'm a hiker, I'm a pilot, a private pilot. And it got to the point where I was so debilitated with pain, angina, shortness of breath. I have 4 dogs. My husband and I rescue dogs, and we transport them. That's why we fly. And they're big dogs, and I was just struggling just holding a dog's leash. So I was seeing a lot of doctors in the United States, and unfortunately, this condition isn't recognized by all cardiac surgeons in the United States. And I did my research. And there are about 4 or 5 doctors that I was kind of interviewing on the side and listening to their interviews, reviewing their CVs, their resumes. And there were a couple that I was pretty interested in selecting as my surgeons for this unroofing procedure. The more I researched, the more I realized that they're not up to speed. Not nearly as up to speed as Dr. Kofidis. Dr. Kofidis is far superior in this, in my opinion. He not only treats the myocardial bridge that's seen in images. When he goes in, he digs deeper safely, and he unroofs the entire artery to really help with the discomfort of the endothelial dysfunction, which is part of this condition. So once I did my research, I needed to have a meeting with Dr. Kofidis. Once I had my meeting with Dr. Kofidis, I realized that he and Hygeia Hospital was really the only place for me. That's how I ended up here. Well, from the moment I told Dr. Kofidis, which was pretty quickly after we had our 2-hour Zoom meeting, and by the way, in that Zoom meeting, I had already sent him all my images. I had, like I said, 4 years of experience with this. I had many images. I had 2 CT angiographies. And so he was really able to identify the problem. So once I told Dr. Kofidis, yes, I'm going to move forward, he put me in touch with the International Patient Coordinator, and that is Gregory. And Gregory sent me all the information that I needed. He didn't miss a beat. And any questions that I had about traveling to Greece for this procedure, they were answered. And the unknown is very challenging for anybody, especially, emotionally, I'd been through a lot. And when us as patients who are suffering so much have unanswered questions, we fill in the blanks. And all those blanks were filled in with the correct answers, not with unknowns. And Gregory was amazing, helped me with the transportation. From the moment I landed at the airport with a sign that had my name on it, I felt literally handheld, it was just amazing. I kind of felt, this is kind of silly, but kind of felt like I was royalty. It's like, wow, this is amazing. So Gregory was incredible. Then I met the rest of the surgical team, Dr. Patakos, who's incredible and has the energy that I have. They just explained everything. And so that was my first day. That was pre-op. Then the day of surgery. I've had surgeries before, and never have I had a surgical nurse like Georgia. She deserves an award. She loved on me like she was my sister. that's how I felt. I really felt like my sister was caring for me. She was so amazing. Then her assistant and her brought me up to my room. That's a very uncomfortable time when you're being transferred from ICU up to your room. And it's scary, you're in pain. And I think that it's not so much the pain, it's a lot of it is the medications that they have to put in you. You've got all these toxins in you, and you're not acting like yourself. So it takes a very patient staff, and that staff on that floor couldn't have been more patient with me. I cried, I was scared, I was in pain, I was begging for medication. They're incredible. I don't know if I would have been so patient. So it was incredible all the way through. So, everybody. Then I'm diabetic. So then I remember like my second day, I had asked for orange juice. And so I had some orange juice brought in, and the dietary staff, she came in to bring me my breakfast, and she quickly, as soon as she saw that there was orange juice on the tray, and she saw that I was diabetic, because she read it on my card before she gave me my tray after she asked me my name, she quickly took the orange juice away, and I didn't realize how strict the dietary guidelines were going to be. And I thought, wow, training here is amazing. So everybody was amazing. I wish I could name everybody and thank them. So when I first met with Dr. Kofidis over my Zoom meeting, at that time, I was still very interested in a robotic procedure because, of course, a robotic procedure is going to have fewer drawbacks and quicker recovery and less scarring and all that great stuff. And after meeting with Dr. Kofidis, he explained to me, and he's known as a minimally invasive surgeon and as a robotic surgeon. He's world renowned. And so I thought, wow, I'm gonna get the best for my robotic surgery. And he explained to me that for him, the most important thing is the outcome. And I said, well, yeah, that's the most important thing to me too. And then he explained, and this is the other difference. Every doctor here, and I have a lot, explained everything. And that's all we want. Like I said, otherwise we're filling in the blanks and we're not gonna get it right. And they explained everything. And he said, Mary, I see your images. It's demarcated perfectly. You have a myocardial bridge where your LAD is twisted and dipping deep down. It's not visible, and it's going to be challenging to get to robotically. And quite honestly, I'm not comfortable. And I said, thank you. And I the more I thought about it afterwards, and even since my surgery, that should never be that important. The scar shouldn't be important. Recovery time shouldn't be important. With the pain I was going through for so many years, really the only thing that matters is the outcome. So if the outcome isn't the number one thing, maybe someone's not ready for surgery. And I couldn't be happier, and I don't care about my scar. And I'm recovering just fine. Probably just what I said, what I reiterated, which was prioritize correctly. Make a list of what you really want to accomplish with this procedure, whatever your procedure is, foot surgery, whatever, orthopedic, heart. What's your goal? Is the goal outcome to get back to a wonderful life, a safe life, and in my case, to have a healthy, brand new heart? I would say, make sure you know what you want your outcome to be, and then find the Dr. Kofidis that works for you. I absolutely couldn't be happier. I think he saved my life.